Hi everyone, Dr. Hall here, and I'm going to go over with you the celiac trunk, stomach, and spleen. So before you get going, you want to have a ton of arteries because the celiac trunk has a ton of arteries branching off of it. For my vein, I'm going to use purple because we're going to be talking about the portal venous system. And I'm going to have a bile duct and a stomach and a greater omentum. So we're going to start with the most posterior structure, which is going to be the spleen. It's kind of shaped like a kidney bean. It's not a kidney, right? I'm going to put it way over here on the left side. And my most posterior structure also is going to be the splenic vein, which comes from the spleen, obviously, and is draining blood into the hepatic portal vein. So I'm going to show my hepatic portal vein here. So you might remember the hepatic portal vein drains all the blood from the intestines that is full of everything you just ate up into the liver. I'm going to move this a little bit more superiorly for processing before that blood then gets dumped into the inferior vena cava and goes into the general circulation. So this little stub here would be my superior mesenteric vein. This is my hepatic portal vein, splenic vein. Okay. So obviously the spleen is also going to get an artery, and that artery, the splenic artery, is one of the branches off of the celiac trunk. So the celiac trunk is the first major artery to branch off of the abdominal aorta. So once the aorta crosses the diaphragm, it becomes the abdominal aorta, and the first artery that comes off of it is the celiac trunk. Okay, I'm not going to show the aorta here, but that's supposed to represent my celiac trunk. All right, so coming off the celiac trunk, we will have three arteries. We will have the splenic artery. I'm just going to make that flat. The splenic artery, which is one of my favorites because it's very kind of big and squiggly. All right, so we're going to have the splenic artery going off to the spleen on the left side. We're also going to have the left gastric artery coming off to the left, and then the common hepatic artery. I'm going to move this a little bit over so I have more room. And the common hepatic artery heading off to the right. So let's start with the common hepatic artery because as we follow that out, we're going to find a lot of branches. So let's get going with that one. So just to review again, celiac trunk, left gastric, splenic, and common hepatic arteries. The common hepatic artery is going to course to the right, and then it's going to bifurcate, split into two. And when it does so, these are going to change name. So the part of the common hepatic artery that heads up toward the liver is going to be called the hepatic artery proper. And the part that then heads down towards the duodenum is the gastroduodenal artery. The hepatic artery proper is then also going to bifurcate into, I'm going to make this a little smaller, right and left hepatic arteries. All right, so there's our right and left hepatic arteries coming off the hepatic artery proper. We're also going to find a little tiny branch coming off of the right hepatic artery, which is going to supply the gallbladder, and that's called the cystic artery there. We'll have one final branch coming off here, and that is a little tiny artery. Let me use this one, I think it's smaller. A little tiny artery that's usually coming off of the hepatic artery proper, although there is variation from person to person. This one is the right gastric artery. So we have the left gastric artery here, we have the right gastric artery here. Okay. So celiac trunk, splenic artery, left gastric artery, common hepatic artery proper, right gastric. Left and right hepatic arteries, cystic artery, gastroduodenal artery. As the gastroduodenal artery travels inferiorly, I'm going to add another structure before I do some more branches off of this. The green guy. So this is our bile duct or common bile duct that's draining bile from the gallbladder down into the duodenum. Okay, so we're going to put that there. And then take advantage of this moment to add in our Hepatoduodenal Ligament. So the Hepatoduodenal Ligament is a band of connective tissue that encircles these structures up here that are heading to the liver. Like so. Okay, so that's my Hepatoduodenal Ligament. All right, so gastroduodenal artery is heading inferiorly, and it's going to send off a little tiny artery to the top of the duodenum called the supraduodenal artery. So that makes sense. It's going to go to the top of the duodenum, supraduodenal. And then the gastroduodenal is going to continue down. It's going to actually travel posterior to the duodenum, and then it is going to bifurcate or split into two. And when it does so, now it's going to change name. So this one is going to become the right, because we're coming from the right side of the body, gastroomental artery. This one is the superior pancreatico-duodenal artery. So it's going to supply the duodenum and the pancreas. All right, so let's look back at our left side here. So here's our left gastric, and it is going to send off a branch that travels superiorly, while the rest of it is going to curve inferiorly. And so to give us some context, I'm now going to bring our stomach in. I don't know if I made it big enough. I think I did. Okay. So this is our stomach. My Play-Doh is dry, so it doesn't want to stick. All right. So here comes my left gastric artery off the celiac trunk. It sends off a branch that travels superiorly, that's the esophageal artery, and then the rest of the left gastric artery travels inferiorly around what is termed the lesser curvature of the stomach. You remember this little right gastric artery? Well, I kind of made things too far away. It's going to come around and also supply the lesser curvature of the stomach. Here, but from the other side, like that. Okay, let's talk about the parts of the stomach. So up here is my esophagus. So this region right here is the cardia. Think of heartburn, that's how I remember it. This right here is the cardial notch. So you have the cardia, cardial notch. This part of the stomach, which is the most superior part of the stomach, this is the fundus. This whole region is the body, and then down here we come to the pylorus. We have the lesser curvature, and then a little clink in there, which is the angular incisure, and the greater curvature. And so I think my battery is low, and so I'm going to have to pause for a sec.